Hi, welcome to Pathology Riddles. Today we will be dealing with the topic infective endocarditis. So what is endocarditis? Infective endocarditis is an infection of heart valves or the endocardial muscle that leads to formation of vegetation. So what is vegetation? Vegetation is basically thrombotic debris and microorganism. It is often associated with destruction of underlying cardiac tissue. What are the sources of infection? There can be dental or surgical procedure, contaminated needles used in IV drug abuse, or occult sources from gut, oral cavity, or trivial injuries. What is the etiology? 50 to 60% of infective endocarditis is caused by Streptococcus viridans. 10 to 20% is caused by Staphylococcus aureus. Enterococcus also plays a part. Then is Hasek group, which includes Haemophilus, Actinobacillus, Cardiobacterium, Echinella, and Kingella. So Streptococcus is more commonly associated with damaged valves. Staphylococcus aureus with healthy and deformed valves and intravenous drug abusers. And no organism is found in 10% of the cases due to already used antibiotics. Coming to pathogenesis, it affects normal or diseased valves or prosthetic valves. The diseases which affect valves are rheumatic heart disease, mitral valve prolapse, bicuspid aortic valves, and calcific valvular stenosis. Now, what are the sites from where bacteria is seeded to these damaged valves? It can be pacemaker lines, indwelling vascular catheters, and endocardial damage by flow jets. Which are the host factors which contribute to infective endocarditis? So there can be neutropenia, diabetes mellitus, immunodeficiency, alcohol consumption, malignancy, and intravenous drug abuse. What are the types of infective endocarditis? The types are basically based on tempo and severity. It can be acute or subacute. Acute infects normal valves. It is usually due to highly virulent organisms. There are destructive lesions and morbidity and mortality is high in spite of antibiotics or surgery. In subacute cases, the infection is usually to diseased valves. It is infected by low virulent organisms. It has a very prolonged course and recovery is good after antibiotics. So coming to gross. Grossly, the vegetations can be single or multiple. It can affect one or more valves. The heart valves which are commonly affected are aortic, mitral valve, and tricuspid valve in IV abusers. Grossly, the lesion is friable, bulky, and vegetations on heart valve which can involve surrounding areas also. Coming to microscopy. The vegetations of acute and subacute show fibrin, inflammatory cells, and microorganisms. Subacute vegetations also show granulation tissue because there is time for repair at their bases and includes chronic inflammatory cells. There is fibrosis and calcification as a result of this inflammation. Coming to complications, it can erode the underlying myocardium, causing a ring abscess. It can emboli to other sites. Emboli can cause septic infarcts, that is, infarcts along with infection. And mycotic aneurysms can occur if bacteria from emboli infect the arterial valves. So, arterial valve, if it becomes weaker, there is chances of aneurysm in it. Clinical features of subacute includes fever. In older patient, in absence of fever, non-specific fatigue, weight loss, and flu-like symptoms, and splenomegaly. Clinical features of acute include fever, chills, weakness, lassitude, and murmurs. These microemboli can give rise to petechiae and nail bed hemorrhages, also called sphincter hemorrhages. Retinal hemorrhages called Roth spots, painless palm or sole erythematous lesion called Janvey lesions, painful fingertip nodules called Osler nodes. Diagnosis is by positive blood culture and ECG or echocardiographic findings. Now coming to prognosis. The development of complications, there are complications including glomerulonephritis, septicemia, arrhythmia, and systemic embolization. So, septicemia because there is already an infection and it will spread through the blood. Arrhythmia due to destruction of conductions, what you call as conduction pathway of heart. And then there is systemic embolization. The emboli which is coming out will go to other parts of the body. Prognosis of infective endocarditis will depend on virulence of the organism. So Staph aureus has a 60 to 90% cure rate with antibiotics. If the organism is low virulence like Streptococcus viridans or Streptococcus bovis, then the cure rate is around 98%. But aerobic gram-negative bacilli have only 50% cure rate. So 50% fatality rate is there in aerobic gram-negative bacilli. Treatment consists of antibiotics, which will be 6 weeks or more of IV antibiotics. And if the valve is already damaged, then there will be valve replacement. This is all about infective endocarditis. Please share and subscribe the video. If you have any questions, you can write in the comment below. Till we meet the next time, this is Dr. Bismay signing out.